In one of your YouTube videos, you had hosted an extensive session on mental health. It was a wonderful conversation, which was a proper eye opener for a lot of us. As someone who has undergone treatment for clinical depression, it's actually great to see more people talk about it in the public. And I've even loved how Virat Kohli and even Deepika Padukone have stressed upon it and tried to make awareness among the public. I think more people like them should be encouraged to talk about it. What do you think has changed in recent years, and what do you think needs to change, especially in sports where depression is still looked upon like a taboo topic?
I think there's a lot more changes that have happened in the society. The societal pressures or the societal stigma that was associated with anybody having a little bit of a mental health issue was something that a lot of people was one of the reasons perhaps for a lot of people ignoring to address that or even accepting the fact that they needed help.
Yeah.
I think of late what is happening is that a lot of people are beginning to realize that is also a kind of ailment, like you have a physical ailment at times, a cough or a fever, or let's say anything else. So people have begun to accept that that is also a kind of health issue which has to be addressed. Otherwise, what used to happen in the 70s, 80s was that it's just that people were told that to get on with it. I have gone through this, so in comparison, what you're going through is obviously something that is negligible kind of uh, viewpoint would come if you approach somebody and said that you had an issue. And to be honest, also, this field was something that was really not familiar to many people in those bygone decades. I think it's only of late a lot of things have come in, a lot of awareness has come in about the fact that there are different branches of psychology. Psychology is different from the mental health kind of treatment that one has to undergo. So there's a lot of awareness, there's a lot of distinction between all these branches, be it psychology, be it the mental health side of it, however you want to look at it. You have to first be aware as to where you had to go, what you need to do. And I think is what my daughter Subiksha, who was a guest on that show, was trying to impress upon, because she's done three master's degrees in psychology in different fields of psychology. So that's what she was trying to impress upon. People tend to sort of club everything and use a generic term. So this is where the confusion, creeps in. It was a viewpoint, and I'm glad that a lot of people are now shedding whatever inhibitions they might have had in first accepting that they needed help, and then after accepting, going ahead with the next step of approaching somebody for help. So that perceived stigma that might be attached to you within the society or by the people in the society is something people are absolutely gotten rid of. And that's the reason you see a lot of people coming out with it and seeking help, which is fantastic.
Yeah, just to add to that point, what do you think needs to change? I mean, develop in sports, like from the management side to look after the players, because it is there in the national teams right now. We have a sports psychologist. In football, almost every club has a sports psychologist, but in the lower levels, like in the state teams and all the other small teams, what do you think needs to change? What should the managements of those sides do to, empower this process?
We all first need to know the exact meaning of the words or phrases we use, because I feel that most of the times that we tend to use a lot of phrases rather loosely. We talk about mental strength. If I were to ask somebody to describe mental strength, I don't think I'll get a very lucid answer. If I talk about sports psychology, if I talk about mental health issue, I don't think I'm going to find many people who will give me a proper explanation of those terms. So it does not serve anybody any purpose if we just go on using phrases very loosely. First, we have to ask questions to get it very clearly in our mind as to what exactly that particular phrase means, because these are very, very critical phases. Let's not, take it lightly. For example, in the field of sports, a trainer would come to me, for example, sorry, trainers, I'm not running you down. A trainer might come and tell me, I'm doing functional training. Suppose I were to ask him, boss, please tell me what is it that you mean when you say functional training? He needs to be able to explain. If he can't explain that, then it's a problem. Not only to the athlete, but also to the trainer himself. Because the communication is absolutely a non-starter. So similarly, what needs to change is the fact that everybody needs to make it a point to try and find out what exactly the other person is conveying. There is no harm in saying, I don't know the meaning of this phrase. It's as simple as that. So that is what we need to do as individuals. And as far as help from the system is concerned, system cannot identify what help an individual needs, because all the individuals are products of their environment and products of the circumstances that they live in and they face every day. So the individuals will know better as to what is happening to them, what is happening around them, and what is triggering the responses that are being triggered within their system. And the other thing is that in the case of sports, a coach can only brush up or help an athlete or a cricketer or a footballer or a hockey player in terms of improving the technical skills. But in terms of the mindset getting better, in terms of the mental skills, complementing or enhancing the technical skills, or helping the athlete perform to the best that he or she can, that mindset issue is only based on how an athlete feels. And as far as that particular aspect is concerned, it is the athlete who knows. No coach knows, no psychologist knows, nobody knows. Even the mental health specialist will only try and address whatever it is that you have to undergo or whatever you have to counter only when you come out and explain what it is that you're going through, which means the onus is on the individual to first understand his or her own mind, her own body, the workload that the body can take. All these things the individuals must make it a point to become aware of. So, if you had to ask me to explain in one word to your question, I would say awareness.